So I've got my patient here in front of me. This is going to be a spay patient. First, we have to identify what the procedure is. So the exam is already being done with the DVM and the animal is considered healthy. And it is a female, so we are doing a spay here today. So we need to know what our landmarks are for the spay. So our landmarks are going to be, we're going to find the xiphoid process at the top here. Then we're going to come about 1 inch to 2 inches caudal to the xiphoid process. We're going to find the umbilicus. So the umbilicus is where we're going to shave about 1 inch or 2 above. So 1 inch or 2 cranial to the umbilicus is where we're going to shave. Then you also want to come down to the pubis, and then you're going to be about 1 inch lateral of the umbilicus on both sides. So what we need to do to prepare is we need to make sure that we express the bladder. So you want to see if you can feel a bladder. And if you can feel a bladder, express it. Next, we need to take our patient, flip our patient over, and let our patient stay here for a second. We'd obviously need a restrainer if we were really doing this procedure. And we need to scan for a microchip. So this is my scanner. I'm going to scan back and forth. Then I'll scan up and down. Then I'll scan the other way back and forth. And then the other way up and down. It's not finding a chip, of course, because we have a stuffed animal here in front of us. And then we're going to get our microchip information here. So I've got my microchip sheet. So I need to select the chip that's going to best match my numbers and my chip information there. So I can find that right here. And it matches perfectly here. See those numbers? They're matching perfectly. So now what we need to do is we need to move this over to the side and we will scan. So we want to remove the sticker and then scan just the microchip. And it's scanned there for us. So it's scanned and I can see the number matches with the number I have here. So that tells me that this microchip corresponds properly with the information on this tag here. So what I want to do is I would open this. But first I would take some of my alcohol that I've got on one of my gauzes here, not touching the center, and just prep my area. Circular motions, of course, just like every time we're doing our target technique. We're done with that there now. Now we want to remove the safety. So that white clear bit here, you're going to remove that and you're going to put this onto your microchip. So we want to make sure, like, we're giving any injection, bevel is up. So we have to make a tent between our fingers here. And we would insert the chip in there, making sure that the chip stays in. You can pull on the chip here, making sure that it stays in, so that way it actually is interscapular. So then you would scan the dog, ensuring that he is microchipped and that the microchip information matches the information on the sheet and the information that we have here. So his microchip number is correct. You want to tell your client that you don't want the dog to be active for about 24 hours after microchip implantation. More of a risk in puppies because puppies are going to be more active than adult dogs. So you want to make sure you have that conversation just to make sure that the microchip does not fall out. So we have done all of that. Now what we're going to do is clipping. So we're going to put the dog back into dorsal recumbency here. And I'm going to grab my clippers. Holding my clippers as a pencil, I want to make sure that I position our patient here close to me so I'm able to access him, or her rather, and that I keep the body nice and upright like so. Holding as a pencil, we want to go with the hair to begin with, remembering those landmarks being the umbilicus, 1 inch cranial, to the umbilicus and down to the pubis, and 1 inch lateral on both sides to the umbilicus. So clipping the bulk of the hair here Make sure that your clippers are laying flat. And then you can trim up the sides if you've got a patient that's got long hair. And then I would just switch my blade, making sure that I get a blade that's gonna cut very short. And then I'm gonna come over here, still holding as a pencil, and I'm gonna go the opposite direction of the hair, and I'm gonna get as close to the skin as possible while making sure that I'm not nicking her nipples. So she's shaved. Now we just have to make sure, putting a little bit of chlorhexidine on, and just getting rid of a lot of the debris that is on her. So just an initial quick scrub. Okay.